Hi, Dr. John Deng, chiropractor at Columbia Integrated Health Center in New West. I'd like to take this opportunity to demonstrate to you what the Granston technique does at the cellular level. Over here we have the 6 stainless steel instruments, which are the Granston technique from 1 through 6. Part of the demonstration doesn't include the emollient, but in actual treatment we would actually apply this emollient. It is known as a Granston emollient that has a beeswax based large macromolecule, so it doesn't stain, it is hypoallergenic, it has a fairly nice pleasant smell to it, and we use this to reduce the friction upon the patient's skin when we apply the technique. Down here I have a crumpled up face roll. This illustrates what scar tissue is. Scar tissue, or fibrosis, is basically your body's response to healing. It's your body's way of laying down more tissue to try to protect itself. Scar tissue is of course made up of collagen, but the problem with scar tissue, whether it's an acute injury or a chronic injury, is that it lays down these collagen fibers in multiple directions haphazardly. There's no pattern, there's no array, there's no organization, and the problem with scar tissue is, number one, it inhibits the penetration of blood flow, so therefore the tissues become a little bit hypoxic. Secondly, scar tissue can be very, very painful because it affects the sensory nerve endings. Last but not least, scar tissue limits the normal range of motion of the tissue. So the idea with the Granston instruments is to break down that scar tissue. What I'm going to do is I'm going to demonstrate with GT4. This instrument, what we would normally do is apply the emollient first, and then when there's ample supply of the emollient, we take that Granston instrument and we apply it in a biomechanical, multi-directional application. You can see with the instrument, we physically break down the scar tissue, we reinitiate the inflammatory pathway, and what that does, it gets your cells to proliferate into the area where there's more blood flow. There's the release of chemicals that help with the healing process. And as you can see, we always demonstrate this in 360-degree movements. Depending on the area and the structure involved, that'll determine which of the instruments that I use. As you can see, when we're done, that tissue should be realigned, it should be flatter, and of course it should be functional. The benefits of Granston technique is that it's a natural approach, so there's no medication, there's no pharmaceuticals, but most importantly is that we follow the Granston technique treatment with the proper stretching and strengthening exercises. This ensures that the new tissue, when the scar tissue has been broken down, is that the new tissue lays down along the proper lines of stress, therefore you get the proper range of motion and the proper function back. For more information, you can see our website at www.columbiaintegratedhealth.com. Thanks a lot, and see you next time.